I was born and raised in Sikeston, Missouri, which is a small farming town 4 hours from here. If you look at a map in Memphis and go 2 hours straight north, you'll run right into it. Like a lot of teenage athletes, I thought I was going to be a professional baseball player until I realized that I couldn't throw quite hard enough and didn't really run fast enough, and actually ended up breaking my ankle, and then got exposed to orthopedic surgery that way, and my athletic trainers at school, and that kind of started getting the ball rolling. And then once I started in undergrad at Southeast Missouri State, I never stopped. Arkansas Children's has the only two dual board certified physicians in the state of Arkansas, and myself and Dr. Israel, for pediatrics and sports medicine. So I really like the idea of having that niche area that people can come to and really specialize in. We pretty much see anything musculoskeletal related. Specifically in my practice that's labeled sports medicine, we have some guardrails as far as ages, usually about 6 and up to 22. As far as the injuries, pretty much anything. The most common ones are definitely shoulders, knees, hips, and foot or ankle. But we also see the occasional back or wrist and hand if we need to as well. Most of our treatment plans involve therapies or bracing and things that do not involve having to go to the operating room. So we can also try ultrasound and injections to also see if we can avoid the operating room if possible. And then if we find something that needs surgery, the operating room, we work closely with our surgical colleagues and get them there when they need to. I think the biggest lesson learning each day from the patients is that they're all unique. Each of them have a different set of challenges. Being here in Little Rock in the middle of the state, some people have to drive 3 hours, and that can be a big trip for them. So understanding that some people might have barriers to some care that we would normally provide, and working with the families to understand those, and then also help them kind of problem solve and troubleshoot to see what we can do that's reasonable without making their life harder, because ultimately the goal is to make it easier for them. Most of my hobbies and favorite pastimes really revolve around sports that are just being outside. I really enjoy spending time in the yard and just being in nature, which is kind of what led to sports medicine and being outside anyways. Otherwise, I like spending time with my wife and my dog and just relaxing, reading when I can.